I'm pleased to introduce Natasha. Natasha is a lived experience research fellow at the Pru. She's a peer mentor to students with lived experience and a PhD student at UCL. And she's co-lead author on the Peer Support Ways of Working paper, along with Dr. Ruth Cooper. And I'd also like to introduce Janet. Janet's a long-term carer for someone with severe and enduring mental health issues. She's a carer governor at a local NHS Foundation Trust and a reviewer and carer representative with faculties of liaison psychiatry and medical therapies at the Royal College of Psychiatrists, and also manages to squeeze in time as a lived experience researcher at the Pru as well. So welcome Natasha and Janet, and they're going to present on peer support ways of working. Over to you.
So, hi, I'm Natasha. As Andrew mentioned, I'm a lived experience research fellow in the Pru and a PhD student at UCL. Janet, I don't know if you'd like to introduce yourself as well.
I'd say very basically, my main thing is that I'm a carer. I've cared for someone with chronic and severe mental health issues for a long time now. That's my main lived experience, our main focus.
Thank you. Thank you. And so we're going to present our paper now, Understanding the Roles and Experiences of Mental Health Peer Support Workers in England. And I'm one of the co-authors of the paper, and Janet very kindly wrote one of the lived experience commentaries for the paper. So just to show our acknowledgements again, as was shown by Ruth and Lizzie just a minute ago, and by Ruth and Karen earlier. And just to note as well, similarly to the previous paper, our findings have just come out in preprint, so they're not yet in a published peer-reviewed journal. So we do ask, please, if you wouldn't mind not sharing the contents of this presentation, including any photos outside of this session, with very many thanks. Thank you. So just to give an overview of the peer support workstream that we've been speaking about this morning. So we discussed the umbrella review, and this paper is the second qualitative paper that came out of the large qualitative study. And it's about the ways that people are working within peer support. So I'm just going to hand over to Janet now to do a bit background to the research. So thank you so much.
Right. For a long time now, people who use mental health services or care for someone who does have been calling to increase access to peer support in mental health services. Now, there's been a national drive to expand the peer support workforce, and we've seen a rapid increase in peer support across services. But there's still a lack of clarity about what peer support workers do. This is from people working outside of peer support and from some clinicians. There's also limited literature about peer support worker roles and their experiences in mental health services. This creates challenges for guiding local and national policy and future research in peer support. Next slide, please. But the aims of this study were to understand the broad range of roles and experience of peer support workers across the mental health system in England, so that the team could help identify any developments needed to improve their working lives and their ability to use lived experience to the greatest benefit of people using services. Next slide, please. The research questions that the paper asked were these: what are the distinctive features of peer support? What values underpin peer support? And what is the impact of peer support? Next slide, please. So what we did, to find this out, we did a qualitative interview study that was co-produced with lived experience researchers with personal experience of using mental health services or caring for someone who does. Participants were people working in paid peer support roles in a range of mental health services across both the NHS and voluntary community and social enterprise sector. All interviewers were lived experience researchers. The team interviewed 35 peer support workers, and some examples of things that are asked in interviews were things like their experiences in teams, what they did in their roles, the impact they felt their role was having in mental health. And after 10 interviews, they did a sense checking event to discuss what peer support workers had told them so far and to see if it was similar for other interviewers. I'm going to hand back to Natasha now.
Thank you so much, Janet. So just moving on to what we did with sort of large collaborative analysis, and I think Fiona and Lizzie spoke a lot about this as well. So just to say the point at which we divided into teams. So everybody initially sort of went through one interview that they'd done with a peer support worker, and then we kind of looked for the sort of main ideas and topics, sort of overhead themes that were coming out for everybody in that individual interview. And from that, we created a sort of very large group of themes that sort of spoke to us from across the interviews. And that's the point at which we realized there was so much in those interviews that we divided into the two teams, with this paper focusing on the roles that peer support workers have, really what they were doing in services and some of the experiences that they were having as well. And we met regularly as a team, sort of to continue to refine those themes as we went along, to see what else peer support workers had been telling us within the interviews. So just a reminder, this is the findings sections, which haven't yet been published in a peer-reviewed journal. It's just out in preprint, so thanks very much. It's a reminder to myself as well. So I think Fiona and Lizzie as well spoke about some of the personal information of the peer supporters that we spoke to. So just to speak a bit, to add a few more of those, I suppose. So the majority of people we spoke to were under the age of 55. We spoke to more people who identified as being female than as other genders. In terms of ethnicity, there was quite a small number of people who identified as Asian or South Asian, Black African or Black Caribbean. And most people we spoke to identified as being white British or as another white ethnicity. In terms of the peer support roles people were doing, we spoke to more people who were working in sort of standard peer support worker roles rather than as managerial or senior peers. And as Una mentioned, we spoke to slightly more people who were working in the NHS rather than in other sectors that we spoke to people working in those services. And there was about an even split of people doing full and part-time roles. And so we did speak to a lot of people who'd been in their role for less than 1 year. We also spoke to quite a few people who'd been in the role for up to 5 years and a couple of people who'd even been doing it for more than 10. So thank you very much. So in terms of what we found about what we felt were the distinctive features of peer support from what the peer support workers had told us, we found that the individual sessions that people did were very, very adapted to the individual needs of the person they were working with. They were very focused on their recovery and what the person might need, both on that day and over time as well. The support offered was very holistic, so it encompassed both practical and emotional support and really focused on sort of rebuilding those community connections, helping someone to connect with their local community. And also there was great focus on sharing lived experiences. So that was the lived experience of the peer supporter as a way to help bring hope through sort of living recovery themselves. But peer supporters were navigating some quite complex boundaries around their own disclosure, sort of disclosing their lived experience in a way that so they did not feel overexposed, but also so the sessions remained focused on that person. And we also found that peers were doing a lot of advocating for people within services. So as we all know, it's still quite difficult and for many of us to use mental health services. So peers were really often really trying to make sure that peers that they worked with got the support that they needed or got more support if that's what they wanted. And we found that peer support work was very culturally inclusive, with often the lived experience of peer supporters going beyond mental health to shared other features of identity, such as ethnicity and cultural background. And we also found that many peer support workers were working in a very non-clinical way, sort of not working with diagnosis or symptoms, for example, but really focusing on the individual's needs around recovery. Though some peers, there were some tensions between those approaches with more generic clinical roles, with some peers being asked to sort of have a particular cap on the number of sessions they were doing, for example, where that wasn't necessarily wanted, or a change in approach to focus on particular diagnosis or bringing in particular clinical techniques, for example, different kinds of psychological techniques into their roles. But there was also a lot of collaboration with non-peer staff where they were present as well within the same service. And many peers did feel well supported with their teams. There were often lots of opportunities for shared learning also. And in terms of the sort of values that really came out as underpinning those ways of working for us from what peer support workers had told us, and much of peer support was really grounded in a value that recovery is possible, really hope and belief of recovery for those that they were working with and through modelling their own recovery as well. And because of the shared lived experience between peers and people they were supporting, those relationships were really built on empathy with that person's experiences, and that helped develop that true connection as well, which really, really supported the peer relationship. And in terms of being able to adapt the content of sessions really around the individual, this really came across as being centered on person-centered values even, and really being about that person and what they needed. And many peers describe sort of walking alongside somebody within their recovery journey, not trying to fix the person, but really empowering them in terms of making their own choices and helping them along their own recovery journey. And in terms of the impacts of peer support, so peer support workers often spoke to us about the benefits of their own recovery of peer support. They really found that sort of working in a role that they really enjoyed. Many people mentioned that it was the best job they've ever done, and they really got great joy from their profession, and seeing recovery in people they supported was very, very helped their recovery as well. And in terms of there was often quite a difficult emotional impact as well for some peers. For example, if somebody's lived experience was very close to their own experiences, that could be quite a difficult thing for peers to navigate on occasion as well as it being quite an emotionally intensive role also. Um, and in terms of the perceived impact that peers felt they were having as well on people that they supported, they often described people being able to feel more understood and the benefits for recovery as well, as I mentioned. But also, for example, many peers spoke often about the things they had heard within services, about some people being asked to do additional tasks that didn't necessarily fall within the peer support role, and feeling a little bit underprepared for those tasks, maybe not being offered the appropriate training as well. And also, as with many approaches in mental health, many people mentioned that peer support isn't necessarily right for everybody. So, for example, some people mentioned that seeing somebody else with a different experience of recovery could feel quite confronting for them. So it's not necessarily the right approach for absolutely everybody. And there was also some impacts described on the sort of wider care system as well. There was often descriptions of sort of bringing about systemic change, or what came across to us as systemic change, in terms of really promoting peer support across services and helping the development of those peer support services, and really bringing those opportunities for shared learning, elements of good practice, really through that experiential lived experience expertise, which was developed through, having used mental health services themselves, and just having greater insights into the experience of the person and the improvements of practice that could bring. So in terms of the implications of what we found, so the recovery-oriented ways of peer support workers was their ways of working would be very well supported if teams sort of embraced this fully recovery-oriented approach. And that sort of is rested on teams having a flexibility and adaptability in order to embrace that good practice and new ways of learning that are risen by peer support works as well. And we did find that although many peer support workers did talk about taking on many additional tasks in addition to the peer support role, that where they were doing this, so this wasn't deterring people necessarily from the profession. But there should be a way, and people often still found great joy in their roles as well, but there should be a way of helping people to be supported to draw boundaries around their own roles to ensure that they are able to keep doing the core of their work, and where sort of additional tasks are seen as beneficial, both by peers themselves, the people receiving peer support, by teams as a whole, understanding as well the great pressure that teams are in as well, that sufficient training is offered as well for people to be able to do those as well, where it's seen as beneficial by all. And for what we thought would be helpful for future research into peer support, we thought as well, because one of the benefits of what we did is we looked at a great range of different types of mental health services and sort of different kind of unifying ways of working and values across those approaches. But really doing a bit of survey research could help find out some more specific details about, for example, individual service types, what parts of the role, for example, linked most greatly into job satisfaction for peer support workers, to help understand how they can be best supported within particular kinds of services, but also, and this might also help us find some specific recommendations for individual service types as well. And I think previously it was mentioned around the sort of effectiveness research, seeing sort of how well particular types of peer support that's often developed by research teams, often co-produced as well, those particular types of support. For those, it would be helpful in those kind of studies to use more personalised outcome measures. So we found that in practice, though some people were doing more of that kind of structured peer support, that a lot of people did have kind of open, flexible sessions that were really based around the needs of that person. So having a way where what that person wants and their recovery goals could be measured would be very important in future research also. So Yes, so thank you very much. And yeah, huge thanks to the amazing peer support research team and my wonderful colleagues and all the peer support workers and supporters who are involved in the research. And thank you everyone very much for listening as well. I think we have some time for questions, so thank you.